Computer navigation is a tool that allows me to do total knee surgery more accurately and more precisely. It is a big help in the operating room. The computer itself doesn't do the surgery, I do the surgery. But the computer allows me to make the most precise and accurate cuts in the bone, which we need to do to position the components of the total knee replacement anatomically. So if you look at this model here, you can see the components of the knee replacement. This is the femoral component and the tibial component, the one that sits on top of the shin bone. And the bone is cut perpendicular to the floor here, or perpendicular to the ankle, I should say, and the component is placed into the bone in that position. And similar way, cuts are made along the femur. The computer is a very powerful tool that allows me to make these cuts very precisely. Studies indicate that I can make those cuts more precisely than I could if I was just using my eyes or the older tools that we used in the operating room. The other advantage to having a computer in the operating room is that I can minimize the soft tissue dissection that is necessary in order to perform the knee replacement surgery. In a sense, it's another set of eyes on the patient in the knee that allow me to minimize the exposure that I need to make to perform the procedure. So it's a valuable tool for several reasons. Most importantly is the alignment issue, but secondarily it does help me minimize the incision and minimize the dissection so that the patient can rehab quicker after the surgery. Patients definitely benefit from having knee replacement surgery. Their pain is decreased and their function is improved. It takes a little while to get there. The rehab is a challenge, but patients get to that point. The advantage of the computer is probably twofold. One, there are fewer medical complications associated with using the computer, primarily from avoiding some of the techniques we used with previous surgery before we used the computer. And the other is that it's less disruptive to the normal soft tissue anatomy or the soft tissue around the knee so that patients can rehab more quickly. There's less injury to the muscle, to the tendons, and so that patients can get back to their activities more quickly.